Dr. Nkengasong, as the head of the Africa CDC, what else do you see as primary challenges to tackle this pandemic effectively?
There are a series of areas that we need to focus on to get this pandemic under control in Africa, recognizing that there's a sense of optimism around the world that countries are easing lockdowns, which we all salute and congratulate because the vaccination levels in those countries is much elevated. And if you combine the levels of vaccination with natural immunity, it suggests that there's a substantial level of population antibody levels. However, in Africa, we have to look at how do we scale up vaccines, put more vaccines into arms. Second, how do we increase more testing and decentralize the testing and make sure that we move deliberately towards self-testing so that people can test, get up in the morning and you feel that you have some symptoms and then you test, you say, I have COVID, I'll stay home and protect myself so that I don't go to work and spread it or go out there in the community and spread it. And that is what I call democratizing testing. We have to make sure that you have enough, the new molecules, the new drugs are available in countries. That way, if we have a new wave and a new variant, you can treat people in a way that don't overwhelm the health systems of the countries. Because of the lockdown, many people have spent a lot of time in isolation, and that has created more mental issues that we need to look into and create counseling centers that people can actually go to seek medical advice. Simultaneously, in 2022, if we have a chance of turning the tides against COVID in this year.
Improving the continent's health system has been discussed by leaders for years, yet it seems that things are not moving fast enough. How can this be done, and what are, in your opinion, the essential measures to be implemented?
As a continent, Africa needs to embrace the concept of health sovereignty, or otherwise health security autonomy. They have to look at 4 different key areas. One is to promote the manufacturing sector of what we call health security commodities. That is the personal protective equipment, diagnostics, vaccines, and therapeutics. There is no country in the world that can guarantee the health security of its population without investing in those areas. The second area is workforce, not just in terms of responders, but also young and talented Africans who can engage in research and development that will lead to innovation that can create vaccines, diagnostics, and therapeutics. We can talk about technology transfer, but we should also be talking about technology creation from Africa and even exporting it to the rest of the world. Thirdly, we need to look at strengthening institutions. So the bold measures that the head of states of Africa did during the summit by elevating Africa CDC to an autonomous health agency is part of that vision of strengthening national institutions. And lastly, domestic investment and partnership with the private sector is so important. If we do those 4 things as a continent, then the continent is positioned to begin to drive its own health sovereignty and autonomy. Africa requires a new public health order that will reimagine the way that diseases are fought on the continent.
Many people agree that COVID-19 has shifted the attention and resources away from other important issues. What other health emergencies currently need immediate attention?
We have to recognize that we are in the middle of a pandemic, and that even during this pandemic, we have to deal with even other emerging infectious diseases like Ebola. We should always be mindful that the fact that we're dealing with COVID-19 doesn't mean that other emerging diseases will not occur. We have large issues to deal with respect to resistance to antibiotics. We also have the endemic diseases that are ongoing, the HIVs, the TBs, the malarias. They are creating a lot of harm in the community. A combination of HIV, TB, and malaria kills about 1.2 million Africans a year, so we should never forget about that. The rising frequency of non-communicable diseases, the cardiovascular, the diabetes, and others, is so important that we should continue to look at. So we call those syndemics that the continent of Africa must develop partnerships with to address these syndemics.